can basic science be HARP?
Thanks, Adele. I mean, I think that's a really, really good question, because I think a lot of people ask that, don't they? They think underrepresented populations. And I think the answer to that is that we sort of almost have to go back to the research question itself. It's kind of the answer to most things in science, isn't it? Go back to the research question. So the disease area, or that research question, is related to an underrepresented population or a disease. So, for example, I mean, in the title, a rare disease might be underrepresented. It might not have the support, it might not have the research, the patient's questions may not have been answered in that area. That's not to say that all rare disease research, no matter how it's constructed, is automatically within remit of this programme. But it's certainly a question that can be asked. It may be that there's a phenotype that's overlooked or not recognised. It may be that that phenotype relates to a response group, maybe people that partially respond to a treatment, or they don't respond at all, and yet seem to be always included in clinical trials along with everybody else. So maybe that's the group that requires more attention, and whether that attention is based on, I don't know, 3D in vitro modelling, or using cutting-edge imaging techniques, or cloning a gene that one thinks might be related to that response or to that phenotype, looking at the effect in biochemical or pharmacological assays. Those are the sorts of things that are basic science, but it's the original question that focuses on a underrepresented population or disease. Sorry, go on.
So Will, how about underrepresented communities?
Yes, so exactly that.
Who are reluctant to participate in research, possibly.
So there's the reluctance could be on both sides. So a risk group who one may not engage in the same way that one may engage in other groups. So as I say, bringing another example from hepatology, hepatitis C research would never have got off the ground. We'd never have the eradication therapies that we have at the moment if we hadn't learned that you have to engage with communities. Don't expect people to come to clinics and hospitals in the normal way. So absolutely, recognising what it is that a particular patient group requires. Reiterate what I said earlier, that's not to say that any research question in a socially marginalised population automatically would fit the remit of the HARP doctoral training programme, or an ethnic minority doesn't necessarily mean that. But if the applicant is able to unpick why it is that that particular research question is focusing on health advances in underrepresented populations and diseases, then I think we would consider that as within remit. And that's also another important thing to say, is that understanding and that sort of being able to elaborate the underrepresented nature runs through the recruitment process. So yes, we'd expect to see that well articulated in the application form, but it is something that we're almost certainly going to come back to when it comes to the interview. But it doesn't just stop there, because as HARP runs on, we have training in underrepresented populations research, we've got training in patient and public involvement and engagement. We continue to think about how our research relates to the populations we care about in this programme throughout the time in the PhD. And one other group I want to mention, actually, because I think it may be relevant, again, I've got my liver hat on. Folk with organ failure tend to be excluded from trials. So people living with renal disease are often excluded from cardiovascular trials, notwithstanding the fact that people with renal disease are at increased risk of cardiovascular disease. So that's a typical example. I could say the same about liver patients or people with respiratory problems. So sometimes it's important to look at what isn't being done and ask, what's the relevant question there?
Great, thank you.
One other group which we may not have covered with this is the super rare disease, where really the research would only help 1 or 2 families in the whole world. However, learning basic science mechanisms through these extremely sometimes called experiments of nature we will be able to design drugs or understand mechanisms for a lot larger piece of the population. So it could be basic science on an extremely rare disease affecting, you know, a larger population. So, you know, it goes both ways, underrepresented, helping patients with not so much underrepresented diseases.